Hello, everyone, and welcome back to the Loop Tube. My name is Jeanette, and this is my co-host, Brittany.
Ooh, thanks, Jeanette. Hey, everybody.
Did you like that introduction?
Yeah, I felt like I was on stage.
I feel like I'm getting better at it, right?
Yeah, you're getting better at everything, Jeanette.
I don't know about that. We just spent an hour trying to get this thing to work.
Nobody will know. Nobody will know.
I just told everybody.
I know. It's okay.
Okay, ladies. So this episode is going to be all about the heavy periods and what we can do in order to try to help those heavy periods. So if you or anyone you know has ever dealt with a super heavy period that is just really frustrating, we're going to talk about different options that are available. We're going to talk about what a workup looks like. We're going to talk about when you should come and see us. We're going to talk about during that visit, what we're going to talk about as far as options. And then basically some different treatments that we can try to help alleviate your heavy period. You ready?
I'm so ready.
Okay, excellent. So why does this matter? Like, why should we talk about this? Well, I think it matters because most of us in our life go through some sort of time where we deal with these really awful, heavy periods. And are they to the point where they bring us to the doctor? Not everybody, but most women that come and see me that deal with this heavy period have had this heavy period their whole life, right? Or maybe they're in that perimenopausal time of their life where their periods are kind of all over the place and they are getting heavier. So I think at one point in every woman's life, they deal with that episode where they bleed through their panties. And I don't know about you, but that's freaking embarrassing.
I just shared this story with friends of mine. I don't remember if you were there. I'm going to share it now, though, where we were talking about how when we were younger and that, that would happen. I personally had a pretty heavy flow when I was younger. And I also was not able to have like a purse because I was young. I was like in middle school, so I couldn't have anything on me. I couldn't have my backpack. And so I did this thing where I would stack my pads. This was before I wore tampons. And so I would, let's say I did 3 stacks. 1, 2, 3. 3. Okay.
That's genius.
It's genius, but it's also like
uncomfortable.
I'm sure people were like, dang, she got a big butt. I mean, I don't really, I did in general, like honestly, but so I would go to the bathroom and be like, okay, well, I'm done with this one. Take it off, trash it. Now I got 2 more coming. I mean, that is like pretty genius, obviously for a 6th grader, 7th grader. I don't remember how old I was, but
yes,
a little unreasonable now since there's bigger and better things, but yeah.
Well, yeah, like period panties.
I know we talked
about that on that.
Yeah.
Like genius, like so genius to come up with something like that. Obviously, we didn't have that. I didn't have that. And the amount of panties that I ended up bleeding through during that middle school / high school stage is too many to count. But I love that these girls have that available.
Yes.
So the medical term for this is called menorrhagia. Okay. Menorrhagia is basically just a really big word for, heavy periods, your periods too much, right? You're bleeding too much, not so much like long periods, like the amount of days that you're bleeding, but just the amount of bleeding that's happening during this time. And so basically it's bleeding that's lasting more than 7 days, but it's requiring a pad or a tampon change every 1 to 2 hours, right? So we're talking about these girls that are having like these heavy periods that they're changing a super tampon every 30 minutes to an hour, or they're soaking through a heavy pad every 30 minutes to an hour. And how uncomfortable, because I don't know about you, in middle school, you don't get that much time to go to the bathroom. I know with my boys who are both in middle school, those teachers do not allow them to go to the bathroom that much. And these poor girls, I'm guessing they have to tell the teacher that they're on their period and they have to go to the bathroom. But I don't know. That's kind of embarrassing too for this young.
I have another story about that. I have another story.
Okay.
Yep. Miss, I don't want to say, actually I will, because she was nice. She just didn't let me go to the bathroom once. Miss Piper and one of my science teachers did not let me go to the bathroom when I needed to. And it resulted with blood on a chair.
Well, that's what Miss Piper gets.
I cleaned it myself, but like how mortifying.
Oh.
Middle school Brittany did not love that.
No.
I need to stop making this episode about me. I'm sorry. No, I don't want to make this episode about me.
No, I love that you're making it this episode about you because I'm thinking every girl listening to this has had an episode where they've bled through their panties.
Thanks, Miss Piper.
Poor Miss Piper. How old is Miss Piper now?
Oh, she's probably in her 60s.
Okay, so Miss Piper needs to come see us for menopause.
Probably.
So basically, these girls are soaking through a tampon. They're soaking through a pad. They're having to use double protection or triple, like in your case, quadruple. They're passing large blood clots sometimes. These blood clots are usually bigger than a quarter, right? And they can be pretty big, pretty uncomfortable, pretty scary, right? I don't know about you, but the first time I passed a large blood clot in the bathroom, I was like, I'm dying. Right? I'm going to bleed out and it's not going to be fun. Right? And so I absolutely fear that these girls aren't maybe telling their parents or telling somebody about it. And they're just literally bleeding all of this because they think it's normal. Right? So this episode is to talk about how abnormal that can be and when to get help. So, a lot of times when you're passing this much blood, another symptom can be like dizziness, right? Where you just feel really lightheaded. And that's because you're becoming iron deficient, right? Which then that iron deficiency is leading to anemia, right? And in these patients, their symptoms are going to be just really, really tired, maybe fatigued. They'll also have maybe some shortness of breath, and they'll have some heart palpitations. I had a young athlete come and see me about a month ago, and her periods had gotten to the point where she was needing actually a blood transfusion. And she's 16 years old. She is competing for that college level volleyball scholarship. So she's playing volleyball every weekend, plus during basically the school year for their school volleyball too. And she was walking around with a hemoglobin of 6.
Oh my God. Oh,
right.
Poor baby.
Right. And normal is around 13. So just to put that in perspective, she had half of her blood volume that she was trying to play multiple games of volleyball in a day. And so my goal for her was to get her blood volume back up, but also to fix these heavy periods. So they stopped being such a nuisance for her and she could get some help, right?
As a former athlete myself, I want to say that I was accused of not running down the basketball court as fast or as much as I should have. And my Nana, always told my think it's because I was anemic.
I think it's just because you're slow.
Well, no, of course I was being lazy. I just wanted to be on the offensive side. I'm not going to play defense. Are you kidding?
Ew.
But
defense.
Yes, Nana knew that I obviously was anemic with a hemoglobin of 6. And so this is why I was not playing. Hemoglobin of 6 is wild though. Just saying.
I know. I just fell for this girl because she is, she's driven. She wants to do well. She wants to get that scholarship. She is a freshman on a varsity squad. So she's got a lot to prove. And so she didn't want to stop. And she just dealt with this heavy period. And so anyways, we got her some help, and we're going to talk about those different options, but we got her some help, and per my last appointment, she's doing much better.
Beautiful.
So what are some common causes of this, right? In young girls, it's usually a hormonal disturbance, right? It's because their estrogen is high flowing. They're building that endometrium or the lining of the uterus, and it's what they're bleeding off every month. And they've just got an over thickened lining. And some of our other ladies that are kind of past that teenage years, it can be a couple of things. It could be fibroids, which are benign, I hate to say this word, but tumors of the uterine wall, or I guess I should say muscle. And these basically can make these periods a little bit heavier or a lot heavier. They can get really, really big. They can be really, really small. You can have multiple fibroids. You can have one singular fibroid. But fibroids can absolutely cause heavy periods and also painful periods. Another thing is like maybe a polyp, right? So a polyp is an overgrowth of the tissue that sits inside the endometrial lining, and you can get an endometrial polyp. And these things like to bleed. And so they can cause some abnormalities in the bleeding as well. There is another condition called adenomyosis. Adenomyosis is basically where the uterine lining is growing into the muscle. And so if you were to cut a uterus down halfway, you'll be able to see that lining has grown into the muscle of the uterus. And these ladies have heavy periods, like really heavy, painful periods. And the only way this can be diagnosed, actually any of these ones that I just previously mentioned, the fibroids, polyps, or the adenomyosis, is by ultrasound, right? And these are things that we can see on an ultrasound that we look at the uterus.
Yep.
Some other things are like bleeding disorders. So if I have a young girl coming to me and pelvic ultrasound is normal and she's still having this really heavy bleeding, I'm probably going to look into, does she have something called a blood dyscrasia? Okay. A blood dyscrasia is basically where she doesn't clot well, right? She doesn't create the normal clotting factors where the blood stops bleeding. And an example of this can be like von Willebrand, right? And that is a common thing that we can see as far as being a reason for heavy bleeding if it has to do with a blood dyscrasia, is the von Willebrand disease. Another thing that I work up is a thyroid panel, right? I know we talked about thyroid in the last episode, and I had a lot of you reach out to me. So thank you for that. And I'm glad you're listening, and I'm glad I educated you on some things that you could probably do and talk to your provider about. But thyroid can also be a big issue when we're talking about heavy bleeding, abnormal bleeding, no bleeding, right? So that is part of my workup, is checking your thyroid to make sure that's okay. Medications, right? So certain medications can cause heavy bleeding, especially if like a patient is on a blood thinner. So say they've had some other condition, a heart attack, stroke, and they get put on a blood thinner. This can actually increase their bleeding just because they're not able to make that clot. So medications can also be a huge cause of this. Mm-hmm. Another thing is certain IUDs, specifically the IUD that can cause heavier periods is the copper IUD or the Paragard. Most IUDs that we use in the office are progesterone lined. And so you're going to have the Mirena, the Kyleena, the Skyla, the Liletta. Those all have progesterone around them. So they actually thin that lining and they can help with heavy bleeding. But specifically the copper-based IUD or the Paragard can absolutely worsen periods. Perimenopause, right? We've talked about this before. Perimenopause with the estrogen going up and then slamming back down, and it's not at a normal 28-day cycle. Those women can come to me and they've maybe never had heavy periods and now they have heavy periods. And in those situations, we got to get those hormones back in check and get you on something to kind of help with that. So how does this affect people's life? Does it really get in the way? I mean,
wait, hold on.
Yeah.
I think I have one that's not on there.
Oh, okay.
What about endometriosis?
Yeah. So that's a really good question. So endometriosis can also cause heavy periods. Mm-hmm. And usually the difference between this ladies and just like a fibroid lady or a polyp lady or a blood dyscrasia lady is these women hurt, right? They have pelvic pain. They have back pain. They almost feel flu-like before their period hits. And these ladies actually require a whole different kind of treatment, usually a surgical management, continuous birth controls where we're skipping periods. So yes, it can cause heavy periods, but along with that, it's pretty painful. So next question is like, how does it affect these people's lives? And like, does it really matter that we talk about this? I don't think enough people talk about this, right? I think more people should talk about it because the emotional toll that it can just basically cause for these ladies. They're missing out on activities because their periods are too heavy. Maybe they're not going to the beach or going swimming with friends, especially these teenage girls. Maybe they're bleeding through at school, and that's obviously a huge embarrassment. On top of that, you got the physical impact, the anemia that's leading to dizziness, fatigue, just not feeling good, right? And they're literally getting to the point where they are resenting their period. They're not looking forward to that part of the month. And then after that period's over, they've got 3 weeks of reprieve before it all starts back over again.
Yeah. And there's also the piece of, let's say we're not talking about people that are young. Let's say we're talking about people that are older and have partners. Sometimes the partners don't get it. I just
absolutely.
recently, I don't remember what I was watching, but it was something trashy, I'm sure. And somebody had asked a husband, how many tampons does your wife use a day? And he said, 1.
Oh God. They just
1.
don't know. They just don't know.
Which, I mean,
they've got no clue.
But if you haven't been educated, I get it. Like that's a foreign thing. And guys, I feel like sometimes are scared. They don't want to talk about that. We don't.
No.
In fact,
We don't.
some guys are like, if you're on your period, I don't want to see you. Well,
yeah. What?
well, listen,
Whatever.
I don't want to ever see you. So there's that.
So thank God that Daryl was raised by his mom and sister.
Okay. So when is it a good time to say, hey, I've had enough. I need to go see somebody about this?
Yeah, that's a great question. I think that a lot of girls will deal with this for a long time. And then finally they'll be like, you know what? I need help here. And I think there's some red flags that you should look out for. Are you bleeding through protection in an hour, right? So that means like, are you bleeding through a tampon? Are you bleeding through a pad in an hour straight? And I have some girls that'll bleed through a tampon and a pad in an hour, right? And so if you're doing that, I need to see you, right? If your period's lasting longer than 10 days, right? If you're coming to me and you're like, I'm having like 14-day periods, that's way too long. We got to fix that. Right?
Hell no.
Yeah. Right. Like I don't even want a 1-day period, much less a 14-day period. Right. The next thing is if you're having symptoms like of anemia, which are going to be pale skin, your heart racing, you're short of breath, you're fatigued more than normal, just super tired. Yeah. We need to see you, right, for that. Or if you're passing large clots regularly, right? So it's normal to have a period or two where you're going to pass some clots. But if you're passing clots on the regular for every day of the cycle or you're doing it with every period, we probably need to work you up. Okay. I need to see kind of what's causing that. So if you're having that, plus maybe you're having the pain too, or you're having the heavy periods plus the pain, these are all reasons that you need to make an appointment with your provider.
Right. And I think also if there's just an acute change that's very noticeable, that's also probably an indicator that you need to get something checked.
Right. And when you come see me, kind of what to expect, right? I'm going to do a pelvic exam. Even if you're bleeding, do not freak out. You will not be the first or the last bleeding vagina that I'm going to see that day. Okay. So I need you to understand it's going to be okay. And when you go see your professional that takes care of women all day long, we are not worried that you're on your period for a pelvic exam. It might be awkward for you and that might be kind of concerning, but don't worry. Okay. Because we just kind of need to see basically, hey, how much bleeding is this? So we can actually estimate that. Right. And then also be able to see if you're tender anywhere, examine your uterus and see if there's enlargement. See if I can figure out if you have fibroids on exam. Do you have a polyp that's coming through your cervix? So all of these are things that I could actually see on exam that we can then move forward with a plan. I then will probably get some blood work. Like we mentioned, definitely checking the thyroid. I'm going to definitely check and see if you're not anemic, right? So that's called a complete blood count or a CBC for short. I can also do iron studies, which looks at a ferritin, which is your stored iron, looks at your iron binding capacity to make sure that your body's not like, hey, I need iron, and your iron binding capacity goes up, right? I'm checking your serum iron to see how much iron you have floating around in your bloodstream. So I'm going to check all of that. And then I'm going to order a transvaginal ultrasound. So what this looks like is it's a probe, right? A vaginal probe that we put inside the vagina and we get a good look at the uterus, the ovaries, the fallopian tubes, the pelvis. And what that's checking for is ovarian cysts. It's checking the thickness of that endometrium. It's checking for fibroids, polyps. It's checking for all kinds of things, right? To see, is there a physical reason for her to be bleeding this much? And so from there, we take all of that information, right? The blood work, the exam, and the ultrasound, and we're able to make a decision on kind of how we would treat that. And then treatment options, right? This includes both hormonal changes. This includes supplementing iron. This includes trying to get basically your nutrients up in your body to try to help with those red blood cells. But it also includes IUDs and medications and surgical options, right? And what does that look like, right? So a lot of women will come to me and they're like, I don't want to be on a birth control. Okay. We don't have to treat heavy periods with birth control. In fact, there are studies out there that show that high dose NSAIDs can actually help lighten and lessen a period, right? So taking ibuprofen, 600 to 800 milligrams, 2 to 3 days prior to the initiation of that period has been proven to actually lighten that period. And so you want to talk to your provider about different dosings that are available for you and seeing if you're a good candidate for taking these NSAIDs. And NSAIDs are going to be medications like ibuprofen, Motrin, Advil, Aleve, naproxen. And these have been proven to help kind of lighten that period. Other options are actually treating the actual bleed itself with a medication called tranexamic acid, which is also known as Lysteta. Lysteta is a medication that you take 3 times a day for 5 days, the first 5 days of your period. And what this does, it actually helps you bleed less, right? So it's a non-hormonal option that allows you to use this only during the time of your period to lighten that period. So then there's the women that are like, you know what? I just need help, whatever that looks like. So in this situation, we could do birth controls, right? Which include a whole array, right? We've talked about birth control before in one of our episodes, but there's IUDs, which I would not obviously go with the Paragard for you. I would go more towards like a Mirena or a Kyleena IUD, which is an 8-year or a 5-year IUD. There are oral birth controls that contain both estrogen and progesterone, or the birth controls that are progesterone only. They're the best one on the market, in my opinion, is a medication called Slynd, Slynd. This is a progesterone only pill that has a really good bleeding profile. And I've helped a whole lot of ladies get rid of their period with Slynd. So that is one of my favorites. Other thing is surgical options, right? So what does that look like? Well, obviously there's a full-on hysterectomy, right? So my ladies that are done having children, that are having these super heavy periods due to maybe adenomyosis, like we mentioned earlier, or fibroids, sometimes surgical management is really the only option. And that is going to be more of like a hysterectomy where we go in and actually remove the uterus itself, remove the tubes, and leave the ovaries depending on your age. Other option, which is one of my favorites, is actually called an ablation. And that's where we literally laser off the inner lining of the uterus. And that allows these periods to sometimes and most of the time, just go away. Right. And so you still have the fluctuation of hormones. You're just no longer bleeding. Ablations are great. They're not a birth control. So you have to still protect yourself from getting pregnant, but they can absolutely get rid of that heavy period.
So just for clarity, you can do ablations for your endometrium, but you could also do ablations for the hair on your body. You can ablate the hair on your body
in your heart.
I mean, there's just
we ablate all kinds of shit in medicine.
Well, I'm just saying, I think it's a fun way for people to remember. Like everyone gets laser hair removal because it stops the growth. Right. So let me just do something similar, but not similar at all.
Right. But if it helps you remember it, to talk to your doctor,
thank you.
You want to laser off your uterus.
Well, then everyone's going to remember.
Oh, man. Everyone's going to remember that now. Another is, so say you're not done having kids, right? And you're like, damn, these periods are awful. Another option is a myomectomy, right? Where they actually go in and remove the fibroids that are causing the heavy periods. And there's different ways those can be done. And we won't get into all of that, but that is another surgical option that's available for my ladies who have fibroids who are possibly still considering trying to conceive. And last resort, like we talked about, is the hysterectomy, where we go in and actually remove the uterus altogether.
Which is not obviously something that most people would like to go through, but sometimes it's literally the only option.
Right. And that is sometimes, like you said, our only option. And we tried everything else to try to help this. And it's just, it's not doing what we hoped.
Yeah. Okay. I think it's time for some myth busting.
Okay. Ready?
Number 1, Miss Jeanette.
Yes, I'm ready.
Do heavy periods mean I'm infertile?
No, it does not mean that. And so, I think we talked about in our PCOS episode is that these ladies will go months without a period. And then when they do get a period, it's super, super heavy. Infertility can be an issue in PCOS or polycystic ovarian syndrome. And in these ladies, there's obviously, if you listen to that episode, we talk about all kinds of options for PCOS. But a lot of times, if they have a thickened lining, when I find that on ultrasound and they're having these heavy bleeding episodes, I do recommend what we call an endometrial biopsy, where I go in and actually take a sample of the cells of the endometrium just to make sure that this period or lack of period, and when they get a period, it's super heavy, making sure there's no cancer cells, right? But as far as making you infertile, if you don't have a diagnosis of PCOS, no, that's not true.
Myth busted.
Busted.
Okay, second one. Is this just normal for some people?
Yes. There are some ladies I can run all these tests, right? I do the blood work, I do the exam, I do the ultrasound, and it's all normal. These ladies just have heavy periods, but that doesn't mean we can't treat them.
That was me.
Yeah.
3 stacks.
Genius.
Number 3, will birth control stop my periods completely?
Sometimes. Depends on the birth control. Mirenas, which are the IUDs with progesterone, have a high chance of stopping your period. Birth control pills that are taken continuously, what that means is skipping the placebo pills. A lot of times it will stop your period completely. Depo-Provera, which is an injection that you give yourself every 3 months, which is a birth control that's progesterone only, can also stop your period. And Nexplanon, which is a bar that goes in your arm that releases progesterone over 3 years, can also stop your period. But I must say, these also can cause super abnormal bleeding profiles, right? So they bleed and then they stop bleeding and then they start bleeding again. So that is an option, but just know that that can happen as basically that can be also a cause of these birth controls.
Thank you.
You're welcome. Happy to bust all the myths.
All the myths be busted. Hey, before we close things up, you know we got to do it.
Are we talking about slippery solutions with
B
and
J?
J?
Dear B and J, I listened to your supplements episodes and loved it. Unfortunately, I am so overwhelmed with the amount of supplement brands available. Now I have a better idea of what to take, but how do I know what brand to use?
Man, this is a hard question because there are so many brands out there and I get it. It's overwhelming, right?
The biggest issue too is the regulation issue of it all, right?
There is none.
No regulation.
Right. Correct. So they could put whatever they want in there. I can tell you what I use personally. And personally for like my vitamin D, my super B complex, my turmeric, however you want to say it, and my DIM, I use a specific brand called Micro Ingredients. And they've got some really good product. Just because I have actually retested my blood levels after taking it and I do see improvement in how I feel. And they're affordable, right? Because a lot of these supplements could get really expensive. So what I like about that brand is it kind of has it all, right? It's affordable, it works, and it's easily accessible.
And as an aside, this is just like a general thing. I know gummies taste really good, but they don't always have the same like efficacy or potency, I should say, as
that's right.
other forms. So,
and I mean, it's just adding sugar.
I get it.
I know, but the problem is you sit there and eat 25 vitamin Ds.
Oh my God. Are these berry flavored? Yes.
They are so good. I'm like, ma'am, your vitamin D is 700. Sorry, they are really tasty.
Yeah. Okay, thank you. That's actually a very good question too, because I think even as providers, we've struggled with that too. Like,
right,
that's hard. Okay, here's a good one.
Oh, we have another one. We have 2 tonight.
All right. Yes. Okay. This one's a little more unhinged, but as expected.
My favorite.
Dear B and J.
Hello.
My boyfriend likes to watch porn, specifically as a form of foreplay. I could do without it personally, but I go with it because he says it turns him on. Initially, I was game for it, but as time has passed, it has become more of a chore for me. I find my boyfriend using things he has watched in porn in the bedroom, and quite frankly, it isn't working because we all know porn is not reality.
Right.
Preach. I want to support my boyfriend and whatever gets him going, but I also want there to still be some romance between us. Help.
Okay. So this comes down to talking to him. Like you got to have that hard conversation. He probably thinks you're into it because guys are clueless, right? So he probably thinks that you're like, oh yeah, this is something that I definitely want to watch as foreplay. And I think he thinks that it's making you hot too. But if it's not, and it's actually making you feel a little ick, then you need to bring that up, right? Because
because that's just going to keep.
Yes, because if he's getting something out of it, he's going to think you are too. And if you don't say something, we're going to end up in a situation where you don't even want to get intimate with him because you know what that's going to be.
Right. And then there's resentment. And then there's, I don't even want to be in a relationship with you anymore.
I know. And that's like
I know that sounds outrageous.
But it's true. I mean, sexual health in a relationship is so important. And if that's not something that you feel comfortable talking to him about, then you've got to figure out a way to bring it up and just go with it and get uncomfortable because the outcome is going to be better than you just sitting here dealing with it.
Right.
Bummer though.
Yeah.
That's hard. And it really does come down to these men thinking that they're turning you on. They really think you're probably into it. And if you're not, then you need to say it because it's important for you too to feel comfortable. It's not just about him.
Speaking of porn, I just read an article that somebody from Boy Meets World she was on Boy Meets World, but not like a main character, but then she went on to be an adult film star. And she just went on the podcast and basically was like, y'all hated me. Like, bro, like this is like a podcast, a very popular podcast. And she just really gave it to him. Gave it to Topanga. Told Topanga.
Topanga. Wow, you just brought it back.
Yeah, I just literally just read that. Yeah. I don't really know how that has anything to do with this question, but
I don't know, but I like it.
Thank you.
Because I haven't thought of the word Topanga in probably 30 years.
Who thought of that name? Topanga?
How do you spell that?
Okay, remember when you said, how do you say that word? How do you spell that? It has the same rules. If I don't know how to do it, I'm not going to spell it. I'll say it.
Okay.
Topanga.
Topanga.
Phonetically, I know how I'd spell it, but I don't think that's correct. So.
I don't think you're right.
Anyway.
There ain't no
okay, let's wrap this. Let's wrap this up.
Got it. Wrap it up.
Okay, so I mean, overall, we know that heavy periods are definitely common, but it's not something that you just have to be like, well, I guess I just have to deal with this forever.
Correct.
I mean,
correct. Absolutely. Go see your provider. Talk about it. Get all this, these questions answered, and then get some treatment for yourself, right? Whether that looks like a birth control or a non-hormonal birth control of some sort, like the Lysteta, like we mentioned. Is it a surgical option? I don't know, but you definitely need to sit down and talk to your provider and get evaluated and see what the next best step is for you, because you don't have to live with this heavy period.
Janet.
Yeah, that was a good one.
Yeah. I told someone this weekend that I called you Janet, and they thought it was hysterical. Just saying.
Well, I think it's great because my supervising physician, as you very well know, because he is also your supervising physician, thought it'd be really funny to call me Janet today.
Well,
Dr. Cox, I love you, but you called me Janet today.
That's also what HEB calls you. So
get it Starbucks. And Starbs.
So weird.
Oh, you know what I forgot to mention is congratulations to Jennifer Orozco. She won the hat in our giveaway on Instagram. Whoop, whoop.
That looks so cute.
I mean, she's going to look so cute. And I'm excited for her. So we're going to do another one as far as our giveaway. That was really fun. A lot of y'all shared our Instagram. A lot of y'all commented and had tagged your girlfriends. We like that because that means you're sharing all this information with your friends and your girlfriends and your family that you love best. So thank you for doing that. And I hope you love your hat, Jennifer.
I don't know why she wouldn't. Hello.
Right? Hello. It's so freaking cute.
All right, y'all. This has been fun.
Good times.
Great times. And there may be some technical difficulties in this one. And we're sorry, but we sure tried.
Man, we are not IT specialists. That's all I know. I can't even figure out a printer. Okay. Bye.
Bye.
The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.